Hi everyone. So today we're just going to do a really quick discussion on tongue position in the mouth and tongue posture and its effect on our overall well-being. And it's something that we don't really give a lot of thought to. Like a small thing like our tongue, how can it affect everything in our body? So I want to ask all of you today, and I don't know if you can enter it into the chat. You don't have to just answer this in your mind, but right now when your mouth is closed, where is your tongue? Where is it in the mouth? Think about it. If you said it is up on the palate, on the bottom, yes. On the bottom. If your tongue is on the bottom of your mouth, behind your teeth, bottom teeth, it actually is in the wrong position. Let me admit this one person in. Oh, looks like he took care of that. Our tongue should be, turns out, and thanks for volunteering that answer, because most of us are probably too shy to say it, but a lot of us have our tongues sitting on the floor, touching top teeth. Yes, so our tongue should be behind, up at the top, the tip of the tongue should be behind the front two teeth where the gums and the teeth meet together. That junction, we call it the spot. That's where the tip of the tongue should always rest. And the rest of the tongue should also be stuck to the palate. But not everyone can do that. So we'll talk about that, because sometimes our palates are arched and narrow and our mouths are small, and we can't get that tongue all the way to the roof of the mouth. And that's a very common issue, for which we often in our childhood saw dentists who extracted teeth, or orthodontists who extracted teeth, and because there was crowding. The reality was, it wasn't that your mouth was crowded, it became crowded. The reality was likely that your tongue was in the wrong place. So it's very important for us, especially as children, to train them, but even as adults, to train ourselves to keep the tongue at the top of the mouth, the tip of the tongue behind the front two teeth, and try to keep the tongue as far up on the palate, flat as possible. Tongue posture, good proper tongue posture helps us breathe better, helps us sleep better, helps us feel better overall, and it also helps us look better. And I'm going to go through these reasons, and I have a little anatomy model here that I'm going to bring in. But these are osteopathic considerations. I didn't introduce myself. My name is Aparna Dandekar. Sorry, forgot. I am an osteopathic physician here at the Institute of Health and Healing in San Francisco. I have a career in, before I came here, in primary care and urgent care, and also osteopathic medicine and Ayurvedic medicine. That's a different topic for a different day. But my job as an osteopath is to look at structure and look at function and look at the interrelatedness in our body. So like I was saying, tongue posture affects so many things: breathing, sleeping, feeling better, eating better, chewing better, looking better. And the correct posture is up at the top of the tongue. So let me show you here on this model, because I don't want to necessarily show you the insides of my mouth all the time. If some of you are eating lunch, maybe that's not the best thing. But here you have a cutaway, right? If I cut my face in half and show you the profile, you can see it's a really bright light. Maybe too bright. Is that better? Better there. The tongue takes up a large part of the oral cavity. And you can see it's not just the tongue that we see. It has so many muscular connections throughout the whole oral pharynx. And also fascial connections to our neck. We're going to talk about neck pain and tongue position. That is also very important. But as you can see, our primary breathing apparatus is the nose. Look at how much space in our face is dedicated to breathing through our nose. The mouth has no such structure. You have the tongue, which in this model is at the roof of the mouth in proper anatomic position. And you have a huge area here, the size of your fist inside your face, or a billiards ball, dedicated solely for breathing. So oftentimes when I have patients with nasal congestions and allergies, we have them working on decongesting the nose by using more of the nose and less of the mouth. So we work with proper tongue posture and getting the tongue in the proper position, getting the mouth closed, and then relying solely on the nose to open up and breathe. I have so many, I wish I could actually, Kate, maybe we can in the future make this a 4-part thing, because there's so many things to talk about. And I want to cram it all in, but we only have 15 minutes, 20 minutes. But the tongue, when it's up at the roof of the mouth, what that prevents us from doing is ever using the mouth to breathe. We should never, ever use the mouth to breathe. The mouth is only for eating, and the nose is for breathing. Look at all these dedicated, rich structures for breathing. The turbinates, the sinuses, the hair set, all of these things, the large surface area for purifying, filtering, cleaning, warming, humidifying air. The mouth has none of those adaptations, right? If you look at all the animal kingdom at large, the only animal that breathes through its mouth is sometimes the dog when it wants to pant, right? When it's a hot day, it can't sweat, maybe through the pads of its feet, but that's it. It opens its mouth to breathe. No other animal hangs its mouth open to breathe. If you saw a farm animal, if a farmer saw its cow standing around with its mouth open, it'd probably shoot it, because something's, I mean, that's violent, but it would cull those animals out of the herd, or think the farmer would think that animal is sick because that mouth is hanging open. It's an unhealthy look for animals. But humans, modern humans, we have this habit of hanging our mouth open, mouth breathing, and when my mouth is open, guess where my tongue is? It's on the floor of my face, of my jaw. But if my tongue is up, I can't get air back up beyond that tongue, right? It's blocking that whole seal, it's blocking that whole airway. So I cannot get air in through my mouth. I'm forced to breathe through my nose. So when the tongue is up, we breathe better because we're breathing through our nose, which is the structures that we were intended to breathe through. Secondly, tongue posture is important in the formation of proper dental alignment. So our tongue acts as braces. When our tongue is up, it gives so much force. It's a very strong muscle that when our tongue is up on our palates, our teeth come in properly around the tongue, right? The teeth will grow in around the tongue and avoid the tongue, right? You don't want to ever chew your tongue. So if your tongue is up all the time at rest during the day when you're not talking, and when you're sleeping all night, when your mouth is closed, the teeth will grow in properly. And if the lips are closed, they act as a retainer. So the tongue acts as braces, and the lips being closed act as a retainer. Between the tongue and the lips, you have nice alignment of those top teeth. When our tongue falls to the bottom of our mouth, several things happen. Our palate doesn't have that tongue pushing up against it, constantly forcing the bones of the skull to open up, expand the palate. What ends up happening is you have the palate grow arched in an arched fashion, right? Instead of nice and broad where the tongue fits in, it's an arched, high, narrow palate, and that affects the shape of the face. It affects the shape of the teeth, how the teeth come in. So oftentimes they'll come in crooked or crowded, and the dentist will take teeth out, or the orthodontist will take teeth out. But now we know that if we had trained the tongue up since childhood to keep it up, the teeth would have come in straight. So now there's ways to remedy that. There are appliances to expand the palate, and there's things to do that you can do, open up the palate without having to extract teeth. But that's one way to do it naturally, is to have your tongue be your own braces. It's important to educate children, especially, to keep their mouth closed. Let's see. when our tongue is on the bottom of our mouth, when it's in the lower jaw, and we breathe through the mouth and our nose is congested, what also happens is when we lie back to sleep at night, that tongue, which is not a muscle that's toned anymore, when you keep the tongue up at the top of the roof of the mouth, it's exerting a force, and there's a type of muscular tone that it has that makes it strong. But when it's kind of flopping at the bottom of the mouth, it's a weak muscle. It's not exerting its full potential. And so that same tongue becomes floppy at night. So now this guy goes to bed, and the tongue then just kind of is limp and flops backwards. And all of these mucosal surfaces are also weak in muscle tone from not being up all day and keeping that resting muscle tone. Everything's weak, and guess what you get? You get sleep apnea, right? Because look how narrow this airway is. It's so narrow. So when the tongue falls backwards in the mouth and it's not kept up at the roof, it falls back into this airway. So then what happens with sleep apnea is that tongue is back there, right? And you can hear when you snore, right? So if you snore, and I'm making the snoring sounds, what did you do? You had to make that, in order to make that sound, you had to narrow your airway, right? You had to make everything loose so that those things could vibrate to make that sound. So when it happens naturally, the tongue is back down here. You get a blocking of the airway, and the person stops breathing for a bit. They're not breathing, right? They stop breathing, the spouse can hear it, and then the brain starts registering after several seconds, oh, we don't have enough oxygen, or oxygen saturations are falling from 100% to 90 to 85, and then the brain wakes up the person. So you get this startled response, and the person breathes again, and it's going to be a chaotic, non-rhythmic breath. It's going to be a startle, and this is all happening while you're asleep, right? And then you go back to sleep again, and the cycle repeats itself. So you don't ever get refreshed sleep. You don't ever wake up refreshed, because all night you've been startling and waking up and startling. Even though you've slept through it, your body has been on alert. The whole time you've been stressed and fighting for breath throughout your sleep. So you wake up exhausted. You wake up with high stress levels, high cortisol levels, and those high cortisol levels leads to diabetes and hypertension and weight gain. You gain more weight, obesity. That causes the neck circumference to be bigger. The neck becomes bigger and heavier, and the whole thing becomes floppier. So this cycle of sleep apnea, sleep disordered breathing, weight gain, depression, feeling sluggish, feeling exhausted, allergies, asthma, COPD, anxiety, all of this snowballs, and it just gets worse and worse and worse and worse every year. So that is why tongue posture is so important. If you feel like it's hopeless, it's not. If you feel like your tongue is on the floor, how do I get it to get up there? There are exercises to train the tongue, to make more room in the mouth, to get it up there. So when the tongue is floppy and weak, what happens also is that the airway gets squished. And what the person naturally does is lean forward like this, right? So you can't see me, but they end up over time to make room in the airway. There's a tendency for the human body to correct that poor tongue posture by doing this. So you get forward neck posture, and then you get that little hump in the back of the neck, right? It's so common. We see that hump back here, T1. Becomes prominent in order to support this cantilevering neck, right? You can try it yourself. You can see how much strain it puts back here. This bone gets bigger, these muscles get bigger, so you get that hump neck. And then you get poor posture, and that pain translates all the way down to the low back and to the hips. So you get neck pain all the way down to the pelvis, to the sacrum. And so it's so important to get that tongue up there. So if you make the n sound, the N sound, n, That position is where the tongue should be. Over time, with exercises, you can get the entire tongue to rest up at the top of your mouth so that you can do exercises that are like what we call suction ups, like this, where you can take that string and really stretch it. The frenulum or the frenum, that becomes nice and stretchy and long, and you get that tongue up there, and it stays up there. And it has so many implications with allergies and asthma and panic attacks and anxiety that I can't share it all in this presentation. Maybe I will work on making it a 4-part presentation for the future, because I'm just now, as I'm talking to you, I'm having all these ideas of what I want to talk about. So it's 12:18. I have a couple more minutes for you. Some of the things that we can do to increase our tongue strength is tongue circles. So one of the things I like to tell my patients is, this is why I have my camera on so you can see me make ridiculous faces, but you take your tongue and you go, can you see me? What happened? My computer just logged out. Hold on. Okay, can you see me? Oh, you can, oh yes, for those on the phone, yes. So, yes, and for, I know some of you are calling in. You close your mouth, okay? And as if you are making large circles, I mean, for those of you on the phone, let's do a different way. Imagine you put Nutella or peanut butter all over your mouth, the outside of your mouth, kind of in your upper lip area, like if you're a guy, your mustache area, and under your lips, and you had to lick it off, right? And you make really large, exaggerated circles with your tongue. So you could do it that way with the tongue outside the lips, and I'll do it now. It's not my favorite exercise because it gets all wet, but watch me. I'm basically pretending to lick Nutella off my face, my own face. If you don't see me, it's probably a good thing. Similarly, you can do the same exercise on the inside with your tongue. And run it. I'm doing the same thing. Going around in a big circle with my tongue against the inside of my lip and inside of my cheeks, big tongue circles. So I like to tell patients 9 to 10 circles in one direction, 9 to 10 circles in the other direction. And if you do that, you're going to start to notice something. We won't do it right now, but oftentimes when they first do it, their tongue gets really tired and their jaw starts to hurt. And 9 times out of 10, the back of their necks will start to hurt. I'm showing you on the model, because the tongue has so, and this is beyond the scope of today's presentation, but the tongue has so many fascial connections. Look how large it is. What we see is the tip of the iceberg, the proverbial iceberg. It goes deep. It has so many connections with the whole head and neck that oftentimes for headaches and neck aches, I have people exercise the tongue and get the tongue to be stronger. And then we work on tongue pop, which is kind of the sound that you made when you mimicked a horse when you were a kid. You take the tongue, suck it up to the top of the palate, and drop it down hard. And it makes so tongue pops are one way to do it. Suction ups, where I showed you earlier, some people can't do that. It takes practice. So some people go like this with their tongue just up, curled backwards. But the real exercise is to flatten the tongue and have it suctioned up against the entire hard palate on top, and then open the jaw and maintain that suction. Open wide. So I have them do that exercise several times to loosen up this whole neck, head and neck area. And one of the side benefits of getting the tongue to be positioned properly is that it can make the neck look younger and tighter. And that's a side effect. I mean, sometimes if I have to sell it from a vanity viewpoint, so be it, whatever. If I can make someone be more motivated to do these exercises, then it helps reduce that sagging chin look too. So you get the chin nice and taut, and then the platysma muscle here in the neck becomes nice and tight too. So it helps with from that angle too. So there's so many ways that the tongue that I haven't even touched upon, that the tongue posture is so important when it comes to headaches and neck pain and back pain. And of course, that translates to our mood, right? Like if you're in pain, low-level pain all the time, at some level you can learn to ignore it, but at some level you're irritated all the time, right? If the tongue isn't in the right position when you sleep, then you can see how it can fall back in the airway and obstruct the airway so that you're never sleeping properly. You know, if you wake up and there's drool on your pillow, you know that your mouth has been open all night. If you wake up and your mouth is parched and dry, you know you've been mouth breathing. So not everyone is aware of their snoring, right? You may sleep alone, or your partner doesn't notice these things. But some of these tricks to know if you've been mouth breathing at night is if you are waking up with a parched mouth, or if you drool on your pillow, then you know the mouth is open. So if the mouth is open at night, we need to fix that. There's ways I work with my patients to fix that, to get them, and it's a slow process to learn how to use the nose again and how to decongest the nose with time. So reversing those chronic allergies is one of my joys in medicine. Having people postpone nasal surgery to get turbinates taken out has been one of my joys in medicine, to avoid that kind of intervention. Nothing wrong with it, but if we can avoid it, why not? To get people off of their Flonase and their steroid sprays and their inhalers has been an absolute joy. It's all about the patient. It's all about how motivated the patient is and how much work they put into it. I'm just here as a coach for 30 minutes, a little appointment, but the patient does all the work and they do such a fantastic job that the credit goes to them. And they're able to reverse their chronic diseases. So that's my little thing on the tongue posture. Some of you can see me. I forgot some of you cannot see me. I've been pulling a lot of faces that have been probably entertaining at some level. But if you have any questions, if you're not feeling shy, go ahead and ask. Otherwise, I look forward to seeing you at a future talk. I'm going to see if there's anything in the chat. Okay. Oh, one last thing before I go. If you can, if I never see you again, if I never see you in clinic or never do a presentation like this again, if you can check out a TED Talk, it's 15, 16 minutes long, and it's called, you have to put it in the search, it's called Shut Your Mouth and Change Your Life. It is by Patrick McEwen, who happens to be my Buteyko method teacher, but it's such a fascinating, eye-opening, life-changing TED Talk. And I think you would really enjoy it. It's called Shut Your Mouth and Change Your Life. It's a TEDx talk, 16 minutes of your life if you can dedicate to watching that TED Talk. Wow, it's really, really fascinating and entertaining. I really highly recommend that to all of you, because it really will change your life. Any other questions? I'm so excited about talking about this that sometimes I stumble on my own words. Yes, they are good for children. Great question. They are also good for children. There are people called oromyofunctional therapists who have far more training than I do, who work with children to avoid, help kids, even if they're in braces or retainers, to help them make the most of their orthodontia, to quicken their time. A lot of us have had braces, right? A lot of my patients have had braces. And headgear in the 80s, right? We don't use that as much anymore, retainers, and then their teeth shift. So now in their 40s and 50s, they're getting Invisalign. And it's simply because, most of the times, it's because their mouths are open at night. So you imagine you have 8 to 9 hours of your teeth shifting all night long. I mean, just talking about it is giving me anxiety. So yes, there are exercises for children. There are gum chewing exercises. There's so many things that we can do. There's swallowing exercises. We do them in clinic, but if you go to an oral functional therapist, a like Kathy Winslow. I don't know if I'm supposed to, I'm not plugging people as a, this is not a, I have no affiliation with financial link with any of these people, but some of these people who I've worked with have been phenomenal in helping my patients and their children overcome allergies and asthma and fatigue. And once you get those children breathing, their growth takes off. They do so much better in school. They're not ADHD anymore. It's just fabulous. So the tongue is so important. I hope I drove that point home, and I hope to have more talks like this where I can really talk about the tongue. It's such a passion for me. So yeah. Thank you guys so much. Yeah, I think, should I hang up, Kate? Oh, I am in San Francisco at the Institute for Health and Healing, 2300 California Street. And our number is, what is it? 415-600-3503. Shameless plug. 600-3503. That's where we are. Thank you. All right. Take care, everyone.